Good afternoon. Am I audible to you all? Yes, that's good. So, how's today's test? Was it easy? Very easy? Were you all able to answer most of the questions? That's nice. Alright. So as I start with my lecture, starting with my introduction, I'm sure most of you all have already seen me, heard me in the last comparative dentistry lecture. My BDS is from Government Dental College and Hospital, Bombay. My MDS in field of conservative dentistry and endodontics is from Maulana Azad Institute of Dental Sciences in Delhi. The entrance exams that I have cracked was All India 2010, securing 3rd rank, Maharashtra State Exam 1st rank, and Sumed 9th rank. And presently, I am working as an assistant professor in Government Dental College and Hospital, Bombay. The motto is always hard work and perseverance to achieve your goals, your aim. Nothing but the best man always wins. So, all the best, and let's begin our series of 200 questions. As I had mentioned last time, ensure that you all have a pen and a paper in hand, because I just do not always believe in dealing with the questions that are there in the paper, but we need to know a little more theory, back and forth, that has come in the paper, because not all questions can be framed in your 200 set. So the highlights which I mentioned during our discussion, I would like you all to write it down, because in some way or the other, with some twists and turns, the MCQs are always asked around these theory points only. And I hope that whenever, what I would like is that once a question is being discussed, give me an answer to it which you all think is appropriate, and then we can have a discussion over it. If there's anything which you all want to ask during our discussion, you can definitely keep posting your questions and I'll come back to them. Alright, so here we go. Genesis of dental pulp is about dash week of uterine life. The answer to it is yes, the answer is 6th week of uterine life. To this, it is basically the thing that you should know is that dental pulp, which is derived from the neural crest cells, they merge from the lateral margins of the neural plate. The dental pulp, which arises from the neural crest cells, they arise from the lateral margins of neural plate. So around 6th week of intrauterine life, you will have two horseshoe-shaped processes, which is called as maxillary and the mandibular processes. Around 6th week of intrauterine life, there is the formation of two horse-shaped processes, that is maxillary and the mandibular processes, in the area where the future tooth joints will be formed. There you have to write that this is called as these processes, maxillary and the mandibular processes, they basically form the primary dental lamina. Primary dental lamina itself gets divided in vestibular lamina and dental lamina. And again, from dental lamina, you will have the formation of the ectodermal part of your tooth germ, that is the enamel. So the enamel arises from the ectoderm part of dentin lamina, whereas rest all other components, that is dentin, pulp, the PDL ligament, they all arise from the ectomesenchymal condensation of the primary dental lamina. I hope these things are clear, that enamel arises only from the ectoderm portion of the dental lamina, whereas rest everything else like dentin, pulp, PDL, cementum, alveolar bone arises from the ectomesenchymal condensation of the dental lamina, and these all arise at 6th week of intrauterine life. The next question, efferent nerves found in the dental pulp are, the answer to the second question is efferent nerves found in dental pulp. Please post your answers for the second question. Do I have one answer there? Yes. So the efferent nerves are sympathetic postganglion fibers. Now let's discuss a little about the nerve fibers of the pulp. You'll write down there are primarily two types of nerve fibers that are present in the pulp. One is the primary afferent neurons, that is the sensory neurons, and the second one is the autonomic fibers. Now primary afferent neurons or the sensory neurons are of only two types. Predominantly two types that are found in the dental pulp are A delta fibers and the C fibers. So the A delta fibers, you have to remember a few characteristics of the A delta fibers. That is, they are the myelinated, fast conducting fibers. They are myelinated and they are fast conducting fibers, whereas the C fibers are unmyelinated and the slow conducting fibers. Alright. Then for the A delta fibers, write down their diameter as 1 to 5 microns. And the C fibers have a diameter of approximately 0.4 to 1 micron. Now what is the job of A delta and what is the job of C fibers? A delta fibers are predominantly present, or I would say in massive numbers, around the DEJ, that is the dentino-enamel junction. They are the ones which get stimulated first whenever there is an external stimuli in terms of hot, cold, in terms of sharp explorers, in cases of changes in the osmosis. So A delta fibers, which are predominantly present around the DEJ, there is a direct stimulation of these on thermal testing or on osmosis or on sharp explorers. And whenever they are stimulated, they will always give you a sharp pricking pain. I hope you all are writing it down. And C fibers are majority present in the central portion of the pulp. They are primarily distributed in the central portion of the pulp. They are unmyelinated. And they have a very high threshold for stimulation. That means it's only when you have tissue injury, when you have some local mediators of inflammation that are present, that is the time when the C fibers, yes, that is the reason why DEJ is the most sensitive part of the tooth. That is because predominantly you have the A delta fibers. They are the sharp pricking pain sensation that they give, and they have a very low threshold to stimulation. And what I was saying was C fibers, which are present in the center portion of the pulp, they are the ones which will respond when there is tissue injury, when there is inflammation, when there are some local mediators that are produced. Because they have a very high threshold. They will not respond until you have all these factors that come into the picture. And once they are stimulated, whenever there is tissue injury, where there is inflammation, whenever there is any form of pulpitis, especially irreversible, okay, that is the time the patient will then say, now I have a very dull aching or burning kind of a pain. So I hope you all have understood that why in cases of severe irreversible pulpitis, the patient says it's dull aching, it's a very lingering kind of a pain. That's because of the C fibers which then get stimulated. Otherwise, they have a very high threshold. They do not respond to a regular stimuli. Okay? So I hope these differences you all have written. The diameter of A delta fibers, that they are myelinated, that they have a very low threshold. That means they can get very easily stimulated to cold, hot, osmosis, explorers. They are predominantly located at DEJ. They respond in the form of sharp pricking pain. Whereas C fibers, they are unmyelinated fibers, the slow conducting fibers. They have a higher threshold and they generally become active when there is some form of tissue injury. And in that situation, they will be giving you a dull, aching, lingering kind of a pain. And so these are basically your primary sensory neurons or primary afferent neurons. And the second part to it was the autonomic fibers. So in the pulse, you only have the sympathetic autonomic fibers. You do not have parasympathetic supply. You only have the sympathetic fibers, and they are only having the job of regulating the circulation of the pulse. So they are generally distributed around the vasculature of the pulse, and whenever there is any trauma or any tissue injury, then these sympathetic fibers will get activated. They in turn will then activate the C fibers also, and at the same time there is going to be decrease in the blood flow. So you only have two types of fibers, that is the primary afferent fibers of the sensory neurons and the sympathetic postganglionic fibers. They are to be dealing with the microcirculation of the pulse. I hope this nerve supply of pulse is now very clear. Stratum intermedium cells are, we come on to the third question. The answer to the third question, that is stratum intermedium cells are, the answer to the third question, waiting for the answer. Is everyone there? Do we have students discussing things? Yes. The stratum intermedium cells are the squamous cells present between the inner enamel epithelium and the stellate reticulum. The same question can be also placed as what are stellate reticulum cells. In that situation, you are to write it down as that they are fine branches or fine reticular fibers that are present in the center part of enamel organ, which is rich in mucoid. Okay. So that is the very few things that should be remembered about these cells, that is stratum intermedium cells and the stellate reticulum cells. Next question, the dental papilla becomes the pulse at what level or at what moment? Dental papilla becomes the pulse at what moment? We are discussing the fourth question. The answer to the fourth question. Friends, this is the only time when you all can actually solve these questions and discuss your queries. Otherwise, at no point of time you will be able to clear your doubts. Answer to the fourth question is A, that is at the moment the mantle dentin formation begins. See, this is a very direct line from Grossman which says that you have to understand that what portions arise from dental papilla and what portions arise from dental sac. Dental papilla will give rise to your dentin and the pulp. So the minute dentin formation begins, the pulp, the papilla itself will be called as dental pulp at that time. And dental sac will give rise to cementum and the tubules. So, in this situation, you have to know now what are the important things to be remembered about dentin. Now, dentin, write down, it can be divided as primary dentin, or you can call it as developmental dentin or orthodontic. Primary, developmental or orthodontic are one of the same terminology. And then you have the secondary dentin. So now what is primary dentin? What is secondary dentin? Primary dentin is formed during the tooth development, whereas secondary dentin is once the tooth has been erupted. Okay, so primary dentin is during the tooth development, and secondary dentin, which is formed throughout the life of a tooth. It begins or it starts its formation once the tooth is erupted in the oral cavity. Now coming back to primary dentin has two parts. One is the mantle dentin, which is just below, which is the first formed dentin, and it is below cementum and enamel in the radicular and the coronal portion. Whereas surrounding the mantle dentin is the circumpulpal dentin, which surrounds the pulp. So when I talk about mantle dentin, it is comparatively less mineralized as your circumpulpal dentin, and it is the first formed dentin. Whereas the circumpulpal dentin is more heavy mineralized. It has a larger diameter fibers of approximately 500 nanometer. Yes. Apart from this, you should also know that the first form collagen fibers of dentin are the Von Koch fibers, VONKORFF. They are the first form fibers which are formed by the odontoblasts, which have a smaller diameter comparatively of approximately 100 nanometer. Okay, so this is all about mantle dentin, circumpulpal dentin, then primary dentin. Also write down the rate at which these are formed. Very commonly asked MCQ. The rate at which primary dentin is formed is 4 to 8 microns per day. And the rate at which secondary dentin is formed it is slightly slower. It is 0.8 microns per day. 0.8 microns per day. So physiologically, what secondary dentin is formed is at a much slower rate. And suppose if there is any caries or there is any destruction, in that situation, when reparative dentin is being formed, that rate again then increases. That rate again then increases and it may go up to 1.5 to 2.4 microns per day. I hope you all have written all this down. Primary dentin is 4 to 8 microns per day. Secondary dentin is at a slower rate, that is 0.8 microns per day. Please write down the rate at which all dentin is formed. Primary dentin is 4 to 8 microns per day. Secondary dentin is 0.8 microns per day. And reactionary or reparative dentin, which is formed in response to any external stimuli like caries or aging, that is at a slightly higher rate of 1.5 to 2.4 microns per day. The components of primary dentin are mantle dentin and circumpulpal dentin. These both dentin are formed during tooth development, whereas secondary dentin is formed after the tooth is erupted in the oral cavity. Mantle dentin is slightly lesser mineralized. Okay, it is slightly less mineralized, and it is that portion of the dentin that is below enamel and cemented. Whereas circumpulpal dentin is the bigger portion of dentin and it is more heavy mineralized, and its fibers are in the range of 500 nanometer. What was the rate of secondary dentin formation? Can anyone write down, tell me the answer? Rate of secondary dentin formation, I have just mentioned it in the discussion. Yes, that's correct. We come to the next question. True about odontoblasts seen in the apical pulp are. True about odontoblasts that are seen in the apical pulp. What is the correct answer for the odontoblasts that are present in the apical pulp? Yes, the answer is one cell layer. Now there are few things again which you all need to know about the odontoblast. Write down the size of odontoblast, that is, it is approximately 50 microns in height and 7 microns in width. They've asked in one of the exams the polarity of the nucleus that are present in the odontoblast. So the polarity is that these are tall columnar cells and the base and the nuclei is towards the pulp. Tall columnar cells and the nuclei is present towards the pulp. The dimensions are 50 microns in height and 7 microns in width. Now, can anybody tell me what type of collagen fibers are synthesized by the odontoblast? 1, 2, 3, 4, 5. Which type of collagen fibers are synthesized by the odontoblast? It's collagen type 1 and collagen type 5. It's synthesized by the odontoblast. If I have to reframe this question, that which type of collagen fibers are present in dentin, again it is type 1 and type 5. Okay, so the type of collagen fibers that are synthesized by the odontoblast or the type of collagen fibers that are present in dentin is type 1 and type 5. If I have to reframe this question and ask that which type of collagen fibers are present in pre-dentin, then what do you all think is the answer? Collagen fibers that are present in pre-dentin. So collagen fibers present in pre-dentin are type 1 and type 2. Okay. So the difference is that these fibers are produced by the fibroblast and not by the odontoblast. Are you all writing this down? That the collagen fiber is of pre-dentin is type 1 and type 2, and these are produced by the fibroblast. Whereas collagen fibers of dentin are 1 and 5, and these are produced by the odontoblast. I hope you all have written it down. And coming to the thickness of the odontoblast, in the coronal and in some part of the radicular portion, they are at least approximately, as I've already said, they are tall columnar cells, nucleus that is polarized towards the center of the pulp, and they are about 6 to 8 layers thick. The first 2 points of this MCQ is the description of the odontoblast in the coronal pulp, whereas 1 cell layer thick is the description of the odontoblast in the apical pulp. At that point, they become almost flattened, squamous-like cells. Are you all with me? Is everyone writing it down? Yes, good. We come to the next question, number of dentinal tubules in the pulpal side. Again, very important and a very frequently asked question. What is the number of dentinal tubules in the pulpal side? Is it going to be more or is it going to be less? So the number of dentinal tubules in the pulpal side is about 45,000 per square millimeter. Is always more as compared to the dentinal tubules that are present in the around the DEJ. We have to always remember that below the DEJ, the dentinal tubules are fewer in number. Please remember this. Below the DEJ, the dentinal tubules are fewer in number and they are smaller in diameter, in an average of 0.8 micron. And at the pulpal side, the tubules are more in number and they are also larger in diameter, approximately 2 to 3 microns. Alright, it is because of this reason, which I mentioned, that in the deeper part of dentin you have more tubules and that too larger in diameter. It is for this reason that once you start your cavity preparation and if you go deeper, patient will have higher chances of pulpal irritation, because as you go deep, the tubules are going to be larger, they are going to be more in number, there is going to be higher chances of passage of irritants either from the respirative material or the bacterial leakage, and patient will have a higher chances of developing sensitivity. Okay, that's because of the tubules, the number and the popularity and its diameter. Alright, so I hope that I have written down the diameters of the dentinal tubule. At the DEJ, it is in the range of 0.8 microns, and towards the pulpal side, it is approximately 2 to 3 microns. This is all given in Cohen, so you may miss it studying from there. Please write it down. Reparative dentin is deposited in the affected area at the rate of, I think I've already discussed the question to this is, the answer to this is, the answer to your 7th question. Yes, so it's 1.5 microns per day. You have to, whether they are calling it as reactionary dentin or reparative dentin, it doesn't matter, it is the same thing. Reactionary and reparative dentin are both tertiary forms of dentin. The only difference is from the type of odontoblasts that are producing it. Odontoblasts which have been replaced by newer ones, that is new mesenchymal cells, have replaced the older ones because they have been destroyed. They form the reparative dentin. Whereas if the stimuli was not very bad or if it was not very much aggressive or destructive, then the older ones only are able to revive themselves and they themselves produce the tertiary dentin, that is the reactionary dentin. Okay. So the difference is that when you call it a reactionary dentin is when you have the same odontoblast which have escaped any aggressive form of caries or any kind of stimuli. So you have the same odontoblast which will be forming the tertiary dentin, that is the reactionary dentin. The tubules will all be in line with the primary or the secondary dentin which is present. Whereas reparative dentin is the one in which you have newer odontoblasts which have been formed from the undifferentiated mesenchymal cells. So in this situation, if they ask you about the structure of reparative dentin, they have fewer tubules. There is nothing like regenerative dentin. The two classification is reactionary and reparative